Happy holidays, everyone, and welcome to another episode of CTLN Opinion Plus. As you know, this is a place where we talk about the concerns of the Latino community, and this week we have a very, very special guest. We have the Chief of Staff to Governor Ned Lamont of Connecticut, Paul Mounds Jr. Thank you very much for joining us.
Yeah, thanks for having me.
Yeah, I'm sure this year has been very busy for you, especially since you just took over this job right before the country basically shut down.
Yeah, well, I was named to this role on February 28th, and it was very exciting for me based upon my professional career in track as someone who started off as an intern in the legislative office building when I was at Trinity College. And then about 6 days later, I'm driving up from a meeting with the governor in Fairfield County and hearing about our first coronavirus case. So, yeah, I basically have been a chief of staff during a crisis, but couldn't be happier with working with this amazing team and on behalf of this amazing governor.
Yeah, Connecticut has been ahead of many other states and has had better outcomes compared to other states, but it wasn't always this easy. What were some of the biggest challenges early on, and with winter coming and winter here, what are some of the biggest, what have you learned from the first round of this?
I think one of the biggest things that we have learned is that there's so many unknowns. We're now finally in a time of the known. When you take into account that early part in March, I still remember we were in the emergency operations center like it was any other day, a few days after that first case, and we're all in the bunker there, every seat taken up, crowded into a room. We did a crowded press conference afterwards, and that would be looked at as such a no-no. We didn't know about the importance of wearing masks. We didn't know about the importance of social distancing. We didn't understand all the variations in this virus takes on, the symptoms, and the overall effects. I think right now we have more information. I think the reason why we have more information is not only working with our federal partners, our congressional delegation, but also working with mayors, first selectmen, and governors from the states around us. We're all learning from each other to be able to make the most educated decisions to ensure the public health of the people of Connecticut and our nation. So yes, well, we have learned a lot. There's so much more that we still need to learn, especially as vaccines are being approved and distribution is going to start. But we're still in the thick of it here in Connecticut, and we're still in the thick of it when it comes to the overall response on the coronavirus.
Right. And I think this is one of those things that even though we went through it early on in the year, we're still going to have a learning curve. I mean, it's going to be an even bigger learning curve because of a vaccine. How will the vaccine react in large populations? Yeah.
Yeah. Well, you got to take into account, like it's amazing that just the amount of turnaround from scientific development of the vaccines that are having good success in their trials. But when you look at it, you had the Pfizer vaccine, both vaccines, that Moderna and the Pfizer one, they have to be at very cold temperatures. Do we have the infrastructure to do that? Luckily in Connecticut, we have many of our medical partners that do. But then you have the Pfizer vaccine that is a double dose that's taken over a period of time. So while they're doing an amazing job in their production, it still shows that we still have a far path ahead to make sure that the majority of our population is vaccinated to allow us to have true herd immunity within our state as a whole, and not only in the other states as well. So we're still not out of it, and that's why it's important. And one of the main parts that I do and helping to run this organization on behalf of the governor in terms of our state government is that we have to be extremely forthright and we have to be extremely fervent as it deals with getting the message out about the steps that we can take to ensure the safety of each other, our communities, and our families.
Right. And talking about that, on Monday, the governor said he doesn't plan on imposing more COVID restrictions. According to the AP, over 3 dozen doctors urged state officials to close the gyms and pause indoor dining. Why not take more preventative measures with what you're telling me?
Yeah, well, I'll tell you this. Like, we have taken strong preventative measures. We are one of the most strictest states when it comes to overall guidelines. We have put curfews in place in terms of closing of indoor dining by 10 o'clock. We have told our constituents that they should have a stay-at-home order from 10 p.m. To 5 a.m. We have basically put a pause on sports and other activities. I think one of the things that we have shown in our state, and I know the New York Times showed it very well, is that as a state, we have been early and first in a lot of ways in terms of taking these preventative measures. We are currently in our 2.1 phase as it deals with our phase, because we did a phase down from phase 3 to a phase 2.1. But the governor has been very out there in saying that we will take additional measures, but he also wants to make sure that we're taking measures that he knows is going to lead to actual results. So we're at a different part of the crisis where we're taking account so many different aspects, especially at the time in which we have received federal support early on, but we're still waiting and need more federal support. But yeah, we're not letting go in terms of the measures we are taking. The governor actually did meet with those physicians that wrote that letter, and I thought it was a very good meeting. We heard directly about what they're seeing in the front lines, and they heard directly in terms of how the governor goes into his decision making in the balancing act that it is. And the one thing that came out of it is that these individuals, these doctors, these first responders, those who are really keeping the people of Connecticut safe, said, "No, what? We want to work with you, Governor, to make sure we get the message out loud and clear about the measures that you are taking and have taken to keep Connecticut safe." So we are always willing and open to listening to differing opinions, but the key is walking out of the room with each other, understanding where other people lie and how decisions are made. And one thing that I can say for us is it's completely transparent about how the governor makes decisions and how we lead to results.
That's really good to know, and I think it's important, especially with what we're living through. One of, I guess, one of my biggest worries was the lack of federal input. It's been more of a state to state, state by state, and we are very lucky to live on the East Coast and live New York, New Jersey, Connecticut, almost all on the same page. What are the challenges of having to do it state by state rather than a federal mandate?
Truthfully, I wish there was. I think we have said it before, and the governor said it. We wish there was a stronger push from the federal side. The states basically took it on themselves to work together. We weren't told by the federal government to work together. I work and speak to my counterparts in New York and New Jersey and Rhode Island and Massachusetts on a daily basis, where we share notes and we share information about what's going on in their states and what are the next steps that they're potentially looking at. I'll give you a perfect example on that end. The current closures of restaurants, indoor dining at 10 o'clock was something that was discussed with Rhode Island and Massachusetts. And we each went in that direction together. And it has an effect because the virus has no borders. When it came to sports, and we were hearing from Massachusetts that, hey, we are getting a lot of outbreaks that we are seeing from the sport of hockey. It led to us to look further at our numbers. It led Rhode Island to look at their numbers, left New Jersey to work in their numbers. And what it led to was a 7-state collaborative to say, we're going to put a pause on interstate travel for hockey tournaments and not allowing hockey matches to occur where individuals from other states are coming into play. We're each trying to support each other in dealing with this virus. I'm not going to sit here and say that the federal government was 1,000% derelict of their duties. We did receive funding through the CARES Act, through the congressionals, but there was so much more that could have been done, especially early on. And I know my counterpart in New York speaks very much about the role that the federal government could have played in terms of shutting down flights from Europe, similar to what they shut down from Asia when it came to the virus. And that's, in a lot of ways, have been pointed to seeing the virus run rampant because of how it was spreading across Europe and into the United States, where you have two of the largest hubs for travel in the airports in terms of JFK, LaGuardia, and Newark. And we saw a trend where the virus came up basically, as we said, on the Metro North Corridor. The first two cases in the state of Connecticut of the coronavirus were individuals that worked in Connecticut but were New York residents.
Right.
So it really shows you that coronavirus has no borders. We had to work together. It was a necessity to work together. And I think it actually made us stronger as partners, not only on coronavirus relief, but also in other important issues we have to work on behalf of our state and the region.
I have one question left, and it's talking about partnership and being there for your community.
Yeah.
This virus has affected our respective communities much more violently, and I'm worried for my family and for the people around me, and I'm sure you are as well. How can we fix this? How can we get comprehensive healthcare to our communities?
Yeah, not many people know this. It affected me personally. My grandmother died on May 6th, from complications from coronavirus. It was unexpected. It was sudden. It's had an effect on me personally. It has made me want to work that much harder to ensure that others don't go through what my family has gone through with the death of my grandmother. It has affected the Latino community. It has affected the Black community much more, not only in Connecticut, but all across our country. I think one of the things that it screams for is the need for additional work and additional reforms when it comes to the issues that affect our community, particularly dealing with healthcare and healthcare access, when it comes to overall economic mobility and economic status, economic stability. This crisis has, for some people, have been a wake-up call. For others, it was something that they were dealing with very much on the surface. And I think one of the things that we need to do as officials in the state, elected officials as in the governor and the legislature, is that we cannot turn our back on the very communities that have been affected the most by this crisis. This is the time to actually double and triple down on the various ways to support and to create growth within the community. We're actually going through the process of our getting ready for a legislative session, preparing the proposed budget. Yes, we still have our day-to-day jobs while we're managing this crisis. And I think one of the things that we are trying to put a major focus on is what can we do to make real changes to support the Latino community as a whole. And so I'll have more to speak on that, particularly on the side of workforce and community development. But I think one of the major things that we can do right now is support our families, support our communities. I think one of the little things that I have done is I have actually been in closer contact with my family and friends than I probably have in the past 5 years, because of the great unknown that this virus has plagued families and individuals. This should be a year in which there should be a lot of I would say smiles on my face, because of taking on this very new role, taking on this responsibility. But there's still a hole in my heart knowing that my grandmother passed from this, and that a good amount of people in the state of Connecticut have been affected by either by the death of their family member or individuals still going through complications of the effects of COVID-19. So I have a lot of work to do. The governor has a lot of work to do. My team here in the governor's office in the state of Connecticut, we have a lot to do. We're far from spiking the football. But I'll let you know this to everyone out there. I can't think of a more committed team led by this governor to address the crisis that we're dealing with than the one that I'm happy to say that I'm the chief of staff for.
Thank you very much for being so honest. And I'm so sorry for your loss. I can fully understand and comprehend. And I think the state is much better for having you as their chief of staff and for having Governor Ned Lamont on their side. So thank you very much for joining us.
Thank you. Love to come back in the future. I'm a fan of everything that you all are doing. I know I was talking to you offline about my son, who's half Mexican, and just the joy that I have in terms of him learning about his heritage and his culture. Go El Tree. That's all. I'll end with that.
All right. Thank you.
Thanks so much.
All right. That was Paul Mounds, the Chief of Staff to Governor Ned Lamont. Thank you so much for joining us today. This is all the time we have. Don't forget to follow us on all of our social media handles, Twitter at CT Latino News and Instagram at CT_Latino News. I'm Savani Campos. Thank you for watching another episode of CTLN Opinion Plus. See you next time.